Hello, guys, it's your girl Morena J again, and I'm so happy and excited to be gracing your screens to be addressing you guys. It's such an awesome opportunity, and I'm so happy for your support so far. I just feel so loved. I feel so appreciated for those who share my videos, for those who make sure they watch it, for those who make sure they like, comment, and share your ideas and share what my videos have how they have impacted your lives in a positive way. For those who have demanded more explanations, for those who have just been there to see me going and to just gas me up, to tell me keep pushing. I'm so humbled, guys. And so, guys, if you have a meal prep on time, a diet plan, trust me, you will be able to stick to your healthy meal routine. And I'm here, guys, for as little as 500 bob. I write your weekly meal plans or even monthly. We'll just talk. Kindly DM me, talk to me, look for me, and let's walk the journey together. Be it you're obese, be it you're trying to gain weight, you're trying to lose that weight, you're trying to cope up with maybe ulcers, cancer, diabetes, guys, and any other health issue. I'm just here to walk the journey with you and advise you accordingly on what to eat. Trust me, you can't go wrong with me. So, and up to our next video, guys. Today, as I promised you in the previous video, that today I'll be talking about cancer. Okay, my name is Cancer is a disease that occurs when cells divide uncontrollably, or they divide abnormally and spread onto other body tissues. And so I'm sure we know some few causes of cancer, and I'll just mention them randomly. And they include physical inactivity and unhealthy eating. They include alcohol consumption, tobacco, smoking, and sometimes it's just a genetic disorder. It happens as a it cannot be controlled because it's in the genes. It depends with the family history. If maybe someone had cancer, so it increases the risk of you having cancer. So those are some of the causes of cancer, and not forgetting exposure to UV rays, UV radiation, lifestyle indisciplines, the way we live our lives, our behavior is what is making cancer cases rise. There are various types of cancers, which include cervical cancer, which is cancer of the cervix. There's breast cancer, which is very common. There's prostate cancer. We have colon cancer. We have throat cancer. We have blood cancer. We have skin cancer, among many others. And some of the symptoms that are signs and symptoms that you could be having cancer, we cannot conclude on a diagnosis. You cannot give a diagnosis unless you are tested. But there can be symptoms and signs which will appear to just warn you that, hey, you could be sick. You could have a high risk of cancer. And these some of these symptoms are fatigue, just unexplained fatigue, or fatigue that you cannot explain. You just get tired, your body aches, and then there's unexplained or unintended weight loss. You're not doing anything, you're not dieting, you're not exercising, you're not stressed up, but you just find out that you are actually losing weight so bad. You cannot even explain. People are telling you, hey, you are losing weight, and you're not doing anything. You're not dieting, you're just doing your normal things. But then there's you notice that, hey, your weight is going down at a very fast rate. That could be another big warning sign that, hey, maybe you could be having cancer and it's time to get screened. And then another common sign is just persistent fevers at night and sweating. persistently. It means it recurs, not just once, but hey, this night you're just having fevers, and every diagnosis shows that you're okay. You don't have malaria, you're just okay. You're sweating at night, you cannot explain why. That's a very big warning sign that hey, it's time to get screened for cancer. Another one is persistent discomfort or indigestion problems. After you eat, you just feel like you're very uncomfortable. You just have discomfort in your GIT, and it's happening persistently, consistently. If you get tested for maybe things like ulcers, such things, anything that affects the GIT, they can't find anything. It means it's time to get screened. That could be a very big warning sign that, hey, you have cancer. And another sign is that you will feel a lump or just thickening of an area under the skin. A lump. When you touch something, when you touch your skin, maybe your breast, you feel like, huh, there's something, there's a lump, there's something foreign, there's something unusual. That could be a very big warning sign that it's time you get checked for cancer. And my people, it's good to get screened even without having the symptoms. And many medical facilities do offer even free screening, especially for prostate, cervical, and breast cancer. If you ever hear that people are being screened, just love yourself. Create awareness at home, create awareness within your area. Tell people, hey, let's go and get screened for breast cancer, for every type of cancer. And that's how we are going to deal with it, because when we get screened, it's very easy to show. Maybe if you if for instance like for instance you had cancer and you get screened earlier, then they discover that this cancer is just starting, the tumor is just starting to form. uh, you could get treated and cured very easily, as opposed to just sitting and waiting to go when the signs are already here, and then you're told you're at stage 3 or 4. Then that one will be so expensive. Will be it will just put a toll on you, your family, your loved ones. So my people, I'm here um, rooting for screening. People should get screened for cancer, all types of cancer. Kindly, I'm begging you, my beloved people, my beloved friends, my beloved family, my beloved country people, let's go for screening. Because when you get screened and they discover that you have cancer or you are at a risk, it will be easier. Preventing it will be easier than if you finally get the symptoms, you go, you are having cancer. Because cancer takes time to develop, and then you might get that it's always noticed or felt at the end stages. um so the reason why the symptom one of the symptoms of cancer that you have cancer is unexplained weight loss, is because cancer cells demand a lot of energy. They use a lot of energy even when the person is just at rest than the normal cells. Cancer, no wonder they say sugar, cancer feeds on sugar. The reason why you should cut down on sugar is because cancer demands a lot of energy, and sugar is energy. So wherever there's a lot of sugar, cancer cells will thrive best there. Um, so we know that when someone is diagnosed with cancer, there are a series of medication according to your doctor. They will guide you and give you the sessions. And one of the cancer treatments we know are chemotherapy and radiotherapy, and there's even surgery. If there's need for surgery to remove the tumor, surgery is always carried out. And here I'm here to talk about it's a combination of foods that we will consume or will eat to prevent cancer, and at the same time the foods that you need to eat during cancer treatments. I hope you're on the same page. We are reading from the same page. These are just foods to avoid during cancer treatment, and the same foods are the foods that we should eat to prevent cancer. And I'll also point out on the foods that contribute to cancer, the foods that we should avoid to prevent cancer, and the foods that we should avoid when treating and managing cancer. And I'm here not only talking to cancer patients, cancer survivors, but I'm here to talking to the care providers, because when cancer hits, this is a family tragedy. It's a tragedy that affects the whole household, and so everyone is going to be affected in a way or the other. So among the types of diet that you're going to consume to help you reduce the risk of having cancer is a high fiber diet, because a high fiber diet is going to help you control the caloric intake, and therefore it's going to help you maintain a healthy weight, because being overweight or being obese is one of the major risk factors for cancer. And so even a cancer patient who is undergoing treatment, be it a radiotherapy, be it chemotherapy, the patient should maintain a healthy weight. The person should not be underweight, they should not be overweight, but they should maintain a healthy weight in order to be able to cope with the treatment. Because trust me, guys, cancer treatment is not easy. Cancer treatment is not easy, because the mention of the name cancer only affects someone emotionally, affects someone mentally, affects someone spiritually, affects someone physically. It's just another type of stress that you have to deal with. So upon dealing with all these, we have to maintain a healthy weight, because when you are healthy, you will be able to control physical stresses, mental stress, emotional stress, and any type of inconveniences that will come. When you are healthy, you will be in a very good position to be able to cope and manage other types of stresses. So we are going to just discuss about the healthy foods that you are going to eat to make managing cancer easy, to make the treatment easy, and also to prevent us from getting cancer. First of all, you see, cancer itself and cancer treatment really affects your diet. And I know you're asking yourself how. Cancer and cancer treatment is going to affect your diet, is going to affect your food intake in various ways. And one of the ways is constipation. Cancer treatments and medications will just cause you to be constipated. And this constipation is going to make you uncomfortable. It's going to create some discomfort. And therefore, you will just feel like you don't need to eat, because when you are constipated, you just feel as if you are so full and you don't need food. And this way you're going to be deprived of nutrients. So this is how constipation is going to affect your diet. You'll feel full, and so you'll have stomach discomfort. You'll feel so uncomfortable, and you'll be like, I don't need to eat. So that is how cancer and cancer treatment is going to affect your diet and your food intake. And the second way in which cancer is going to affect your food intake is through diarrhea. Many cancer treatments, many cancer medications are going to cause you to have diarrhea. And this diarrhea is going to cause you to lose a lot of electrolytes. Diarrhea is going to cause you to be dehydrated. Another way cancer is going to affect your diet and food intake is that you're going to feel the fatigue. The feeling of fatigue will just make you less active, because when you feel fatigued, so tired, you just feel like sleeping, like resting. So you will burn calories while at rest, but you will just feel as if you're still full. You won't feel hungry, and therefore you'll not feel the need to eat, because most times we eat because you feel hungry. But the moment you're not feeling hungry, and you are fatigued, remember in that fatigued position and fatigued situation, you're still burning calories. um, Cancer and cancer treatment can also cause loss of taste. And if you can't, if food can't taste, you just can't lose, you've lost your sense of taste. So food will be so unappealing to you, because who finds food attractive when you have lost your sense of taste? You see, I think during the COVID wave, or if you've ever experienced malaria, you usually have loss of taste. When you eat something, it's just that metallic taste in your mouth, and you don't even want to eat anything. So that's what cancer and cancer treatment is going to do to you. You will find food unappealing, you will not find any reason to eat. No matter how hungry you may feel, you will not eat. And when you're not eating, if you're not going to eat, this means your body is going to be deprived of nutrients, because you're just burning the nutrient reservoirs, the fat reservoirs, the energy reservoirs, but you're not compensating. The input is so low because of loss of taste. Mm. There's also nausea and vomiting. When you feel nauseated and you also vomiting all the time because of cancer and cancer treatment, believe me, even vomiting itself, you are already losing nutrients through vomiting and body electrolytes. You're already getting dehydrated. And when you feel nauseated, that feeling that you feel like you want to vomit, you'll not even want to go near food. But you see, it also varies, because the different types of cancer have different types of medications and treatments. The drugs they use for the different types of cancers vary sometimes, but most cases you may get the drug which they are using, for example, administering to a patient who has cervical cancer. Some of the drugs can also be administered to a person having breast cancer, because these medicines, most of them, the chemotherapy, most of them are hormonal drugs. For instance, in the case of breast cancer and blood cancer, you will get that steroids are involved in treatment of breast and blood cancer. And steroids have a tendency of increasing our appetite. They will make you eat more and raise the sugar levels. Also, in breast cancer, after treatment with the drug, the treatment is going to suppress production of estrogen hormone. Estrogen is also a hormone involved in metabolism. And when metabolism slows down because estrogen has been suppressed, I mean, the production of estrogen is not as usual. It has been suppressed. It has gone down. And the same estrogen is always used in metabolism. So when metabolism slows down, you are actually likely going to add weight or to gain weight. So when you meet a cancer patient who has gained weight, you have to understand, or if you're taking care of a cancer patient, or if you're a cancer patient who is gaining weight after treatment and you're wondering, it could be because of the side effects of the treatment. They are going to suppress estrogen release, and when estrogen is not released sufficiently, it's going to cause metabolism to slow down. When metabolism slows down, you're going to gain weight. But when metabolism rises, you will lose weight. If we want to suppress cancer, if we are managing, and if we want to prevent cancer, we are going to limit or restrict or avoid saturated fats. Let's go for the healthy fats, which are found in avocado, olive oil, and omega-3, among others. Let's also go for whole grains, like cereals, for whole breads like brown bread. Leave alone white bread. Go for brown bread. Go for brown rice instead of white rice. Go for brown chapati. Go for anything which is whole grain. We also go for lean meat. Lean meat contains little fats, little of saturated fats, and we're also going for white meat, for example, turkey, chicken, but remove the skin because the skin contains a lot of cholesterol in it. We also go for low-fat milk products. Always be sure to check on the food labels in the food stores, in the supermarkets. Before purchasing anything, look at that milk product, look at the food labels. Usually they are listed there what they contain, and always eliminate anything which has high fat. Go for the low fats. The reason you're going to avoid red meat, not just avoid, limit or really restrict red meat, it's because red meat contains heme iron. That heme iron is the one that brings the color, and that heme iron is always producing nitrosamines, and these nitrosamines compound are the ones which are cancerous. They're most likely to spread cancer, and that is the reason we should go slow and cut down on red meat. During cancer treatment and the prevention of cancer, we should make sure we are hydrated. Kindly make sure you stay hydrated and prevent these refined drinks, which are sodas and added calories, added sugars. Let's go for water or just good healthy juices. We can go for fruit juices, in which sugars are not added. And the standard requirement for water is usually 8 glasses of water. But actually, the exact amount of water you're supposed to take is divide your weight by by 2. For example, your 70 kgs, divide by 2, that is 35. Then divide 35 by 8. 35 divided by 8, the answer you get will be it 4. That is the amount of water that you actually need per day. So the standard recommended amount is always 8. But if you really want to know the exact amount of water that you should take or your body requires, it actually varies by your body, with your body size. So you're going to take your body weight, divide by 2, that answer, divide by 8, that is 8 glasses of water, and you will get the answer as to what amount of water you are actually supposed to have in a day. And you also know that cancer and cancer treatment is really going to compromise on our immune system because, as we said, cancer is when cells multiply abnormally and uncontrollably. Instead of these cells leaving the body, they're going to multiply, and when they multiply, they might outnumber the required or the good cells, and therefore even during treatment, chemotherapy, radiotherapy, they are supposed to attack the bad cells, the unhealthy, the unwanted cells, cancer cells. But in the long run, during treatment, you cannot prevent this treatment from attacking also the healthy cells. And we all know the types of blood cells we have, like the white blood cells, red blood cells. And if they attack the white blood cells, which they do, they're going to compromise on immunity, because the work of white blood cells is to help prevent infection. And therefore, when you have cancer or during cancer treatment, your immune system is going to be compromised because the white blood cells, which are supposed to fight infection, they're also compromised and they're not enough. So your immune system should be guarded, should be safeguarded by you eating a lot of vitamins, vitamin A, B, K, like E. You have to eat a lot of vitamins and minerals. We all know they are found in fruits, in green leafy vegetables, even in supplements. You can get supplements if you can afford. And in case of surgery, you see, your immunity is also going to be compromised because your body is trying to heal. Your body is trying to prevent infections. So you should really increase your fruit and vegetable intakes, even if it's 6 cups 6 cups of vegetables, 6 cups of fruits in a day. Kindly eat fruits generously because they're going to work on your immune system, which is very, very compromised. You have no option than to take fruits and vegetables. And also during meal preparations, you should be very careful on food safety. You should consider drinking clean water. The water should be boiled or treated. And then during cooking, you should ensure that your food is properly cooked. The eggs should be properly cooked. The meat should be properly cooked. The vegetables should be thoroughly washed and properly cooked to a required heat to avoid infection, because your immunity is already really compromised. So practicing good hygiene, whoever is the caregiver or whoever is cooking, please make sure this food is of high hygiene. Not forgetting plant proteins. Make sure you increase on your beans, increase beans in your diet, the lentils, the peas, increase them, the soya, just increase intake of plant proteins. We are going to look at the various ways you can cope with these side effects of cancer treatment or cancer itself. And one of the side effects we said are loss of appetite. And to deal with loss of appetite, we are going to consume small but frequent meals. Instead of 3 large meals, please just eat 5 to 6 small meals. This is going to help you because you don't have appetite and you don't feel like eating. Instead of filling your bowl with a lot of food which you will not eat all of it because of the lack of appetite, please eat very small. It will enhance your appetite, and in between eat healthy snacks. And to deal with constipation, which causes a lot of discomfort, consider drinking a lot of fluids, a lot of water, and also incorporate a lot of vegetables and fruits, as I said, because they have fiber, and this is going to help loosen your stool, and it's going to help your bowel movement, and therefore it will relieve constipation. Then to deal with diarrhea, please choose food, drinks, or foods which are high in potassium and sodium, because you are losing a lot of electrolytes, and these electrolytes are sodium and potassium. So that's the only way you're going to replace the electrolytes to make sure you're not deprived of the nutrients. For loss of taste, you can lick or sip lemon, lime juice. Try different spices, different marinades, just to enhance your sense of taste. And for nausea, you can also use lemon, drink lemon water, ginger. It's going to relieve you of that feeling of wanting to vomit. So, my people, maintaining a healthy weight, maintaining a healthy nutrition status is really necessary to help you survive, to help you fight this monster called cancer, to help you prevent the monster called cancer. Actually, it's worth the effort. It's worth the effort to be healthy. It's worth the effort to maintain a healthy lifestyle, a healthy weight. It's really worth the effort to remain hydrated. It's really worth the effort to create cancer awareness to our beloved ones. It's really worth the effort to be there for them. Support these cancer patients, support them. Try to divert their attention when they feel so stressed up. Deal with them when they refuse to eat. Don't force them. Please find a way to deal with cancer patients because they're already having a lot on their plate to chew. They're already going through a lot. They only need someone to help. They need someone to help cook their meals. They need someone to be there to share the meals together. They need somebody to be there to tell them, hey, it's not the end of life. They need someone to add laughter to their days. They need someone to add life to their days. They need spiritual mentorship. And so, guys, be there for cancer patients. Support them. Whenever they need your help, support them. And that is the emotional support. Every battle is won and lost in the mind. So when a cancer patient loses it in the mind, actually he will not live long. But when they win in the mind, they are really going to live long. And guys, as you come to the end of our discussion today, it's my belief, it's my joy that have impacted a life for sure. It's my joy that this message is going to be shared worldwide. It's going to be circulated so that cancer awareness will be created, and people are going to get screened. People are going to avoid. People are going to prevent themselves from getting cancer. And those who are treating cancer already, the patients, the survivors, the victims, we are here to walk the journey with you. It's not the end of life. It's just the beginning of positivity. It's the beginning of living quality life. And guys, allow me to wind up this discussion for today. Thank you for your time. Thank you for your attention.